quite a people person, and it sounds really cheesy, but you do get to help people and you can make a big difference to their quality of life.
I wanted to do something in a profession that was in the caring environment, and I wanted to make a difference to people's lives, really.
I think it's the caring aspect of it. It's having the sort of one-on-one contact with patients and feeling like you're doing something worthwhile. I trained as a therapy radiographer a long time ago and had quite a steep trajectory of promotions.
I chose being a physio because I enjoyed sport and it was the closest I thought I could get to professional sport. Quite early in your career as a physiotherapist, you get to supervise staff, and then as you progress to be a more senior physio, you do get involved in service development. I went into managing a department. I decided that management was what I really enjoyed and really felt I got something out of.
The oncology field is extremely exciting. It's one where pharmacists can have a real impact on patient care. Having that patient focus is very important, which I found very, very stimulating.
I decided when I was quite young, actually, that I wanted to be a physio. I was about 15. I was quite fortunate because I had a relative who was a physiotherapist, and so that obviously sparked an interest. Once you qualify, you become part of the Chartered Society Physiotherapy body, so you have access to courses through the CSP website. So there's a lot of training opportunities available.
After you qualify, you're always learning. There's extra courses and qualifications, and it's kind of endless, really, the things that you can do. I've undergone some Pilates training, so I now take Pilates classes. Even just experience is invaluable.
When I started here, we had senior radiographers who acted as mentors, and it's just nice to have that one-on-one person to have a chat with and to go through various aspects of working in a clinical environment.
I've always been very lucky in the mentors I've had, in that it's a safe place for you to go and speak about how you're doing and what skills you're using and whether you're using the right skills, and for them to give you feedback on this is the things we need to draw out of you, this is what you need to do more of, this is what you need to do less. And that trust is very important in that mentor-mentee relationship.
Since I've been in the independent sector, I've been encouraged to go on a master's course in oncology, which was fully funded by the independent sector. It was a 5-year program, and it was a part-time program, so I was working as well as carrying on with a course. It's opened a number of doors for me in terms of consultancy work and also within the work that I do.
My favourite area of physio is foot and ankle, and I'd like to develop into an ESP in that area eventually. ESP stands for Extended Scope Practitioner, which is a physiotherapist, but they have extra roles and responsibilities. The hospital are basically going to enable me to embark on that journey.
In the independent sector, in my experience, there has been quite a generous training budget, and it allows staff to tap into that and to make use of that for their own personal and professional development. And of course, it benefits the department when you have well-trained staff who are competent to do the job.
Being a physio is more than just having the skills and qualities, if you like, to be able to treat patients. You have to be a really good team player. You still do work closely with a lot of other people, so not only physios but other members of the multi-disciplinary team, so you do have to be able to get on with people.
I've always enjoyed being part of teams, whether it be playing or working, and I think that was something I wanted to instill whenever I was in charge of teams. If staff are happy in their jobs and feel valued and feel part of the team, they'll perform more highly.
I think we develop a good rapport with patients, and it's really how we interact with those patients through their rehabilitation. You do develop quite a bond with those patients. You get a lot out of motivating the patients to achieve their personal goals. You can see them through their rehabilitation and achieve what they want out of fitness.
It makes me feel great when we get positive feedback from patients, and it makes me know that the job that we're doing it along the right lines and we're giving the best care.
I absolutely love my job. It gives a sense of personal fulfillment to be heading out and to be doing something worthwhile. Where I work is just a nice environment. It's like a massive family, which sounds a little bit cliched, but that's what we are, and you do feel like you are working with team members who want the best for their patient, and that's invaluable.